Welcome to the Ageless Woman Podcast, where modern science meets timeless self-care for limitless vitality. I'm Dr. Cindy Groh, a board-certified nurse practitioner and the founder of My Venus Club. This is a space for women who are ready to understand what's actually happening in their bodies and finally get real answers. If you've been told your labs are normal, that this is just a part of aging, or that you just need to try harder, and if you've sat through those 15-minute appointments left with just another prescription to manage symptoms, or maybe feel like you've lost a part of yourself, you're in the right place. Before we begin, just a quick note. This podcast is for educational and informational purposes only and is not intended to replace personalized medical advice, diagnosis, or treatment. Always consult with your healthcare provider regarding your individual health needs. Here we go deeper. We connect the dots between your hormones, your metabolism, your genetics, and your lifestyle so you can stop guessing and start feeling like yourself again. So let's get started. Today's episode is going to be a little different, and honestly, I'm really excited about it. I'm here with Lauren, our movement medicine specialist, and Brianna, our registered dietitian, and we're having a raw, real girl talk about the experiences that shaped who we are, not just professionally, but personally as women. We're going to talk about the moments, lessons, struggles, seasons that changed how we see our health, our bodies, our purpose, and ourselves as women. It's an honest, it's a real, open conversation. And my hope is that as you listen, you feel like you're sitting right here with us because every woman has a story. And those stories are often the very thing that shape how we heal, grow, lead, and become the women we are. So, ready, girls?
Yeah.
All right, let's get started. So, let's see. I guess I can start first. Gosh, how many years do I want to go back? Oh my gosh, that's a loaded question. Okay, so what brought me to really focus on health and wellness? Oh gosh, I was maybe 19, a solid 25 years ago, I think. Yeah. Um, so my kids were going off to college, and I had this crazy idea that I was wanting to have another baby. So my husband at the time, I've been divorced since then, but my husband at the time, we got pregnant, but I miscarried. And so this happened a couple times. And when you go through something like that, it really changes who you are and how you look at yourself as a woman. I found out that I had Hashimoto's at the time. So then I really started diving in to my health and wellness with my husband at the time. And that really just took me to a different place. I also, at that time, the kids were heading off to college, so I was going through empty nest syndrome. My grandparents would come down and visit and stay with me, and I lost my grandmother. She passed away, got really sick, and that was very devastating for me too. So we didn't see that coming. Again, it was a very quick, unexpected death related to heart disease. So those events really started to shape the way I thought about my own health, as well as my family's health. And so it really puts it into perspective when you lose a baby and you lose someone that you love so much. So my journey really started there. What about you guys?
You want me to go?
Go ahead.
Okay. So mine was more of just a flip over from nursing, because I was originally like a nurse. I was going to go into nursing when in college, and I interned with a doctor one year, and I had to step out of the room when he was doing stitches, because I started getting lightheaded.
Oh.
And so then I realized, well, maybe this isn't for me. And I was maybe 2.5 years into college at this point already. So I went to my guidance counselor and I asked, what can I do to still kind of be in this field, and not have to take a bunch of classes over again, but what kind of road can I take to stay in the healthcare industry, and she had recommended dietetics, and it seemed really fun. So many different avenues that you could go down, but because I did like the clinical aspect, I stuck with that. I worked in the hospital for almost 15 years until COVID happened. And then after COVID, a lot of doors opened up for dietitians as far as being able to work outside of the hospital. So then telehealth or remote working was more of an option for me. And then I think as you go through life stages, your interest kind of changes.
Sure.
So definitely in the past 5 years, when I recognized within myself that I wasn't getting the results I wanted from my workouts, and I wasn't getting the answers I wanted from physicians and things like that, I started to look more into the hormone aspect of it. But then, I mean, I didn't even know the difference between progesterone, testosterone, and estrogen. Like I had no idea.
It's quite complex.
So again, just learning so much in the past 5 years about aging, women's health, how your hormones affect every aspect of your body. It's been really fascinating. And now I think that personal attachment to it really makes a difference as well.
Oh yeah, when you have that personal experience.
Yeah.
What about you, Lauren? You're in the hot seat.
Okay. So mine really started when my kids were little. I just remember thinking, having conversations with other women, like we're all so busy when our kids are little, and most women that I talk to feel like they put themselves on the back burner. Everything else comes first. You're tending to the kids and the house and the husband and all the things, other family members that need whatever it is they need. And I just remember telling myself, when Lila goes to school, I'm going to really start focusing on my health, and I'm going to join the gym, and I'm going to start working out and doing the things. And around that time, I had just switched my milk to organic milk. It was like my first change. And I had gotten rid of my coffee mate creamer. And that was a big deal because I had that every morning for years.
Wow.
So that was kind of where I started. And then from there, it just escalated. And then here I am.
Oh, I love that.
And there's so much more, but that's how I started.
Gosh, now that you say that, I guess my health journey was many years before then, because I remember graduating high school and my whole family smoked at that time, back in the early 80s. Everyone smoked, and I just remember I just hated it. I just could not get my family to stop smoking. My parents, my grandparents, everyone was smoking all the time. They would smoke picking us up from school with the windows rolled up. And I just remember disliking that so much, and nobody worked out. And so I remember I joined the gym and I started working out then.
Yes, I have kind of a similar story. I one year I asked for a membership to the gym for Christmas. I was like, that's what I wanted. Because my family smoked. I actually smoked.
I never smoked.
I'm so grateful that I don't, but I hated it. Like, I hated going to school smelling like cigarettes. They didn't work out. We didn't eat healthy.
No.
And I remember craving fresh food.
Yeah, your body craves things.
Fruit and stuff.
But your body needed it.
Yeah. So, yes.
Interesting.
But then it really launched later when my kids were little, and I had said to myself, I remember thinking to myself, I want to be my best self.
Yes.
And I want to see what that person looks like. And that is how it started for me.
Yeah. Yes, it's so true. We always want to be our best selves. And I mean, to be real honest too, there's vanity there for me. I mean, so, I like to feel good and look good. And so that was a big driver behind a lot of okay, I want to work out. I want to keep myself fit. I want to keep my weight in check. So there's a lot of vanity as a young woman that drove a lot of the decisions that I made about my health and wellness. And then as I got older, and then with my kids, again, like you said, as a woman, you're just so focused on running the household, taking care of your husband, your children. you're last on the list. You're not really thinking about it. And then fast forward 10, 15, 18 years, and then the kids are leaving the home, and then you really start to think about yourself at that point. I think a lot of women do that.
Yeah. Yeah.
Well, luckily I started before they left the house.
Yes.
I started when they started pre-K.
That's so good.
Well, one of
That's
mine
so
was
good.
that I wanted to be a good example for them.
Yes, we want to be
Like,
good examples.
I wanted them to see, fitness as a priority in my life.
Yes.
Just like I wanted them to see my career as a priority in my life. I wanted them to see that these are all things that are important to you, and, having integrity, being proud of yourself, and,
Exactly.
and like humility and all of that kind of stuff. Like, those are things that I wanted them to see. So I
Good
always believed
attributes.
that the best thing was through example.
Yeah.
Absolutely. You don't want to be that person that is do as I say, don't do as I do.
Right.
Yes.
So you've got to talk the talk and walk the walk, and especially be that example for your children.
But I do like what you said about, because I think a lot of times making the switch can be so overwhelming for
Oh, it gave me
people.
anxiety at first.
Oh, yeah.
I remember
Yeah.
sitting in the chair getting my hair done, and like we were talking about organic food, and I
Mhm.
just remember my body being like so anxious because I felt like I had to do it all at
Mhm.
one time,
Mhm.
or it wasn't doing anything at all.
Right.
And then I remember having the conversation with my hairdresser at the time, and she was like, "Lauren, just do one thing at a time."
Right. Don't overwhelm
And, yeah,
yourself.
and that's when, it was the milk. It was milk and eggs.
Yeah. milk
Because
and
then
eggs.
you're more likely to keep it and sustain
Sustain
it, create that habit. And then, like, once you've done that for a month, 2 months, whatever it takes, then add in another habit
Yeah.
Exactly.
and make it part of your lifestyle and not just like a fad
Yes.
that you do.
Yeah, and the milk was big for me because I was like, I don't want my daughter drinking milk with all the hormones in it,
Yeah.
and like
Yeah.
starting her
No, it's so
period too
real.
soon and all of the things.
Yes.
Yeah, a lot of it has to do with your children watching you and setting an example, because
Teaching them.
I want my daughter to learn that it's okay to put herself and her health first so that she can take care of other people, because if she's not okay, how can she take care of other people?
Yes.
Right.
So yeah, if she sees me doing that, hopefully please do that for
Right.
yourself.
No, it's so true,
Yeah.
because it is hard for women. We, again, put ourselves lowest on the priority list.
Yes, and for my son to see, and your son to see, this is how,
Yeah.
like, it's okay for a woman to do this.
Yes.
Well, and I think too, one thing that's happened in your life, and just because I've known you for a long time, is that your son sees you as a business owner as well. And so now he owns a business, and he's branching out into more businesses. And, I mentioned this to you last night, that I feel like you should be really proud of what your kids are doing, even though it's so sad whenever they leave and go off and be adults. But the fact that he's out there and trying new things and not afraid, being brave, courageous, I think that has a lot to do with the example that you set for them.
Absolutely. Your
Thank you, Breezy.
Yes,
Thank you
it's
for
true.
loving me.
It is true. It really is. And
Your
that's what I
children-
tell a lot of parents, like, that are so sad when their kids graduate or leave for college. And I'm like, that's what they're supposed to do. And
Yes.
you've done
It's
such a
a
good
proud
job
moment.
as
Yes,
a
but
parent.
it doesn't
It
make
does.
it doesn't
It makes
make
it
it
hard.
hurt any less.
It doesn't make it hurt
It's
less.
such a transition for me.
Yes.
It's hit me harder than I expected.
It is a transition, but it is a very proud moment. My
Mhm.
kids are all
Certainly,
older.
yes.
Yeah.
Very proud, and also
because it's that you've given them all the tools, and now they're going to use those tools and make good decisions, and you're going to be so proud of them. It's really
I
exciting.
am so proud of them.
It's really exciting to see your kids go off and become adults and then get married and have
And you know what?
children.
He sent me everything he bought at the grocery store.
Oh,
And
boy.
it was all healthy, and he was
That's
so
so
proud of it.
Yeah.
Oh,
Yeah.
that's
It was
see,
his first grocery store trip.
Yeah.
I was
see
like,
what impact
yes.
you've had on
Yes.
him.
Yes.
I know, that's
The
wonderful.
first thing he wanted to buy was a Brita to filter the water, and I was
Oh.
like, my job here is done.
That's so good.
Yeah.
Am I
My
allowed to
heart
say Brita?
smiled. I don't know.
Yeah.
My heart smiled when my daughter was and she lived in the dorm last year at college, and she said one of the things that she disliked the most about living in the dorm was not having a kitchen to cook her own food.
Oh,
And I was like, oh, you want to cook your own food?
that's so
Like, you don't want to go to Chick-fil-A every day or Einstein Bagel. Like, it's great that I think that she wanted to eat healthy and cook her food.
That's so good.
Yeah.
So they learn, and then you'll see so much of yourself in your kids, and then you'll see them as parents once they start having children.
Right.
It's so exciting. Yeah.
Well, even to their friends, and I see them like say, no, I can't have that, or I don't need that.
They're an example to their friends.
Yes.
Which is
I
also
think
wonderful.
Do you find your children doing
Yep.
that? Yeah.
Oh, yeah.
I love that.
Yep.
Yeah, it's exciting to know
It's quite
that
expensive to feed them all.
it
but
is. Oh,
when they eat all my grass-fed beef.
You know.
it is expensive, teenagers especially, but it's so worth it.
Yeah.
It's so worth it, and it goes by so fast.
Well, you pay for it now or you pay for it later. That's
Absolutely.
That's true.
Oh, it's so true.
Yeah.
So true. If you don't give them the tools and you don't invest in your children emotionally, physically, financially, then you're right. You will be caring for them, and they'll be floundering, and they won't have the tools that they need, because it's a harsh world out there. Well, it's not easy.
You said that last night to the women at the event, just even us now at 40, 47, 60, 30, we're talking to 30-years. It's like, invest in yourself now.
You have to. That brings me to a really great point I wanted to talk about last night, and I didn't. I thought about it this morning when I was having some coffee after my workout, but I thought about like what really drives my passion when I'm talking to women. I'm so like passionate about them thinking about their health and wellness, and I thought about some of the women there last night. And so I think about my journey, and so starting out as a nurse, being in the hospital, then moving to get my master's, my doctorate, and I've been in every healthcare setting, whether it's been a primary care office, whether it's been a hospice setting, whether it's been assisted living facility, memory care, hospital, acute care, chronic care, long-term care facilities, rehab. And I just saw, and the women, men too, and the impact their choices over the years had on their health, how that impacted their family and their loved ones. And I say the word burden respectfully and lightly, but it also just made me think over the years, like, I don't want to be that person on my family. And I see the family dynamics. It's very difficult on family members to take on that emotional responsibility, that caregiving role, which I've done myself as well over the years with family members, and then the financial burden too. And I just thought, that's why it's so important. If you don't do it for yourself, do it for your loved ones and your family, because if what you do now is going to determine your quality of life as you age. And it's never too late to make changes, but you've got to think about that. And it's reality. It's inevitable. There's not a single person that just goes and lives their life making horrible health decisions and horrible choices that isn't going to have disease set in. Right. It's just inevitable. So I remember thinking about that, and that really drove so much of my passion when I talk about it and when I talk about it to patients, because the choices that they make now are going to determine their quality of life. And quality is very subjective. I get that. Not everybody's quality is the same.
Right. But
still, you want to be able to move. You don't want to ache and be miserable. Right. And, your family worrying about you and caring for you all the time. They've worked all their lives. Their kids are gone off, and now your children have to care for you because you didn't make good choices, so to speak. So that did drive a lot of my passion to do what I'm doing now too, to help women be able to educate them and help them understand how important it is to make good choices.
Yeah.
Because
I think something that, like, like you said, the quality of life that can be put into more like objective is, how many pills do you want to have to take every day?
Exactly.
Well, right. That's like, it's what I was saying about like you pay for it now or you pay for
Right.
it later. You can pay for it by working out, having your gym membership,
Sure.
and eating healthy food, or you can pay later to the
Right.
pharmaceuticals.
You're taking 20 pills a day.
Yeah.
Or do you want to have to be on a special diet because of a diagnosis that
You
you
never
have?
have a brownie again.
Right. Or
horrible.
Well, a lot of people can't go out to a restaurant because they have to be on a low salt diet. So, like, restaurant food adds a lot of salt to food.
It does. But I will say also, sorry for interrupting, Bree.
That's
a
okay.
lot of those people still go out to go out to the restaurants and still make those bad choices. I saw it so much in the hospital, not to digress, especially when it comes to heart failure.
Oh, yeah.
And it was that's a never-ending problem for any hospital situation, any hospital setting, or any long-term care assisted living. Constant turnover in the hospital for heart disease and for heart failure, specifically because it's very lifestyle driven, what you eat.
Yes.
And
they're probably thinking they're taking the pills so they can just eat whatever they want.
And into their defense, they're not being educated properly.
Right.
So education, knowledge is
Why
power.
aren't we teaching this in school?
Well, that's another whole.
We have world problems to solve.
Yeah, and a lot of the stuff I teach and practice in my own practice, I did not learn in nurse practitioner school. I didn't learn in my master's. I didn't learn in my doctorate. I learned the basics. I learned anatomy and physiology, biology, chemistry, but I had to step outside of the box and really dive into the research and talk to other like-minded clinicians and practitioners and get together and study and learn. They don't teach that in school. I'm sure you didn't learn a lot of that as a dietitian. You had to kind of step outside the box to learn
so
more.
much in practice.
Yeah, it's
so much in practice.
It's crazy.
There was 1 year, my master's degree, I did both. So we took classes and I did my internship at the same time. So it was really great being able to apply what I was learning in class right into the field. Whereas the 4 years of undergrad, you didn't really, I might have done a little internship over the summer for a couple weeks somewhere. But for the most part, it was just memorizing formulas. And because dietetics is such a broad major, it's everything from school food service to working at the health department to clinical. So there's so much that you have to learn.
And it's so government regulated, all of those things that you just suggested.
Yes.
So you have a lot of rules you have to follow.
Yes. Yeah.
Which is probably would be so frustrating to me because a lot of those things don't really align with the truth.
No, and the publishing companies that put out the texts that the students in higher education are using, those are influenced also by certain companies. So the food industry is going to be heavily influenced by the food industry, the pharmaceutical industry. So those types of things, they influence the publishing and what goes in certain things, which is horrible to say, but it's the truth. And that's the reality, and that's what we're learning. And there's only so many hours in the day, and sometimes you don't know what you don't know.
Right.
And so you have to believe what you're learning is that's it. That's all we need to know to help people in healthcare, and that is absolutely not all we need to know to help people, unfortunately.
But I think that are they trying to bring nutrition more into the med school?
They are.
Stuff?
They're talking about making a huge push in getting nutrition, let your food be your medicine.
Right.
Getting back to the basics, teaching physicians, nurse practitioners, PAs, anybody that's going in the healthcare field, nurses, all of them, registered dietitians, really helping us, giving us the foundation and making that foundation be what drives what we think about when we start to care for a patient. And I hopefully we'll see it. It's going to take a while.
It's going to take a
long time to get the students educated. I teach as a faculty for Purdue University, and I teach master's and doctoral online nurse practitioner students. And so it's a lot to put new things in curriculums. It takes time to change texts, syllabus, curriculum, what you're going to teach, and it's just going to take time. And I'm sure
So
that's
you don't get
all
to like create that on your own, or like you have a
No, so we have set texts that we use. I go outside the box. When I hold class, I have certain things that I go over with the students, but I also interject. You have liberty as a faculty to teach and help. Now, there's certain things that outcomes and things that we want the students to learn, throughout the semester. And those are important things that we focus on, but you can also take the liberty to teach about some of these things. So the importance of diet and lifestyle and movement, and how to, like I spend a lot of time talking to my students about making that connection with the patient during the patient interview, like before they even physically touch the patient, just really connect how to collect that subjective data, how to build trust, and really how to just build a relationship with your patient. Just start that way and learn how to communicate with the patient.
Well, I would say that's really missing.
Yeah.
From today's
it's very much missing.
There's no relationship.
I know. It's really missing. So I really emphasize that a lot with my students. I call them, which I learned from a mentor that I highly respect. He's passed on, but he always referred to himself, and I think of it this way, as a medical detective. And so I talk to my students a lot about that, to consider yourself like a super sleuth with medicine, a medical detective, and asking a lot of questions and listening to your patients, taking that time is really key. So I think we don't do that. We're in this fast pace, 10-minute visits, 15-minute visits. We don't have time. So that's another reason why I like what we're doing, because I have an hour-long visit, an hour-and-a-half visit with patients, and I'm able to take that deep dive, and they're able to open up, and we're able to really connect and get good information to help us get to the root cause of what we need to be looking at. And it takes time to do that. You can't do that in 10 minutes.
No.
You really can't. So hopefully medicine will swing back the other way, but it's a huge moneymaker. Our healthcare system is such a large part of our GDP. I mean, it's a big business.
Yeah.
So we'll see. Hopefully it will. But it's shaped all of us to some, influenced all of us at some point in our life, our personal health or our family's health, to be who we are today and why we do what we do, which is wonderful, what we're doing.
Truly.
I know, all and everything. So we one of the things I thought would be interesting is to open up about things that impact last night. I'll digress a little bit. Last night we talked about mindset, and so one of the things I mentioned in last night's workshop was unresolved hurts. Those are things, stressful seasons that we have, emotional traumas that we go through. So all of those things influence our biology. They have real consequences on our biology. And I don't think people realize that, women, men, children. And so those are some of the epigenetic things. When I talk about epigenetics, what happens in your environment and how that influences your genes. So mindset and those things that we go through that happen to us from the time we're small until we grow up, those all influence our health and wellness, from our brain to our body. So, and we've all been through all different types of traumas. Nobody has a perfect family or life. I think we've all experienced things that shape our health and our wellness and who we are. And so that's another thing when I'm caring for a patient, or any of us are talking to a patient, giving the patient time to open up about those things too, because that all impacts how we're going to care for them, how we're going to talk with them, how we're going to proceed with their plan of care, testing we might do, we may or may not do, things like that. So mindset's really important, and I think we've gotten away from that too in healthcare.
No, I definitely, that's one of the first things that I take into consideration, even with, with training and working with somebody in movement, because I want to know where their head is at before I before I decide what
Yes.
kind of program I'm going to put them on. Because if I feel like they're going to get overwhelmed
Mm-hmm.
too much, then
Yep.
I will treat them differently than someone that, might have a healthier mindset in that moment.
Sure.
But the goal is always to pull the person into that healthier mindset, like as the time goes by. So it really is like connecting with people and figuring out what their mind is like before you decide what program is right for them. I think that's, and we've talked about that before. I think that's what's missing also in physical fitness with trainers and things like that. I think they're just, it's the one direction for everyone. We're all going to do this movement. We're all going to do this, and we're all going to do this.
That's a great point, because there is no one size fits all.
Right. So I think that we, just like medicine, and how we're talking about like doctors and the mainstream, it's just everything for everybody. It's just, check off the box. Okay, you get this.
The protocol.
Yes.
Right. Yeah, textbook. And women are...
It's important to me to connect with the people, because I want to know, like, how is your mind, and how are we going to make this work for you? Because I want you to feel like you're succeeding, and I want you to succeed.
Yes.
So do you find that with diet too?
All the time.
Yeah.
All the time. I mean, I was just talking to a patient the other day, and she's like, well, I looked up this diet online, and this is what my husband's supposed to eat. And I was like, you're going to be really frustrated when I tell you this, but this is an as tolerated diet. I was like, you need to eat something and see how he reacts, and then decide whether or not that food is appropriate for him. Because I was like, some people, just a little backstory, he had intestinal surgery, and it all depends on which part of the intestine was taken out, absorption
and is he like a real go-getter, or is he like also like a picky eater? Because that matters.
Well,
yes,
so then
it does.
He is a diabetic with congested heart failure. So he's already on a low sugar diet. He's already on a fluid restriction with low sodium. He has cancer, so he's about to start chemo.
That's awful.
And he had a colon resection.
Oh.
So I told her, I was like, once he starts chemo, please do not worry about his diabetes or his sodium. It's like, let him eat what he wants. But again, it's just that I told her, I was like, the doctor is going to tell you that this is the diet he needs to follow. The internet's going to tell you that this is the diet he needs to follow. But his diet really depends on him and how he's feeling that day. And, are you guys going out for a walk that day? Does he need a little bit more calories? Are you, is he in bed? Is he depressed? Is he vomiting? All of those things. And I was like, there's just not one size that fits all. And this is so true with, weight loss, with weight management. It's, not everybody is a 2,000 calorie a day person. No. And it all really differs on their activity and what they're looking for.
Genetics. Especially in women and their cycle. And like, okay, what
season of life?
Yeah. What are you going through, and what can you handle? What can't you handle today? Like, I have someone that's very low in iron, and it's like, okay, until we get this supplemented, like, I'm going to take a few steps back because I don't want
her body's already.
I don't want you to completely shut down. Like, we're just going to go a little bit lighter and move a little bit slower until we get this.
Correct.
Yeah.
So important. And then genetics. That's another whole piece to the puzzle. Nutrigenomics, nutrigenetics. So all of that impacts. And then, of course, nutrition, our gut affects our brain so much. We touched on that last night, because our microbiome produce more than 90% of our neurotransmitters. Our brain and our gut are constantly communicating with the vagus nerve. So if you have an unhealthy gut, it's going to be hard to maintain a healthy mindset. So that is really key, and that's where nutrition really becomes paramount.
If one part of the bike chain is off, it throws everything else off.
Yes, it is really critically key.
And it's not just food and exercise. I've been a dietitian for 20 plus years, and for so long it was just food and exercise. And now we're recognizing that it's not just food and exercise.
Stress.
It's stress. It's sleep. It's hormones. It's
so many things.
What you do in the morning versus what you do in the evening, and what time you eat, and all the things. So
your circadian rhythms.
Very,
It's
very
the
key.
sourdough bread. You
There you
have
go.
to have all the ingredients the right way.
Yes, you do. That's a really good point. And you have to enjoy what you're eating. I tell patients that all the time. So we talk about, okay, this is what your genetics are. These are your nutrigenetics, nutrigenomics. Okay, this is what you should be eating. But you need to like these things. So food should be meals. Food should be a time that you enjoy.
Right.
It's you're fueling and nourishing your body, but you don't want to be miserable doing that.
It's
so we
a
have
social event.
It's a social event.
And it's not for
Okay, you
most
guys,
people.
it's
It's
not
not
always
like
a
that.
No,
social
sometimes it's not, but you want to enjoy.
Sometimes you have to be a grown up and just eat things because they're good for you, not because you love them. Like there is a time that most of the time, yes, but I mean, I think that, you know, I'm going to eat this because this is fuel for my body. Like,
Yes.
I need to eat
But
this.
you can't eat. Sometimes
That's not
it-
every meal forever.
Right.
Not every
no.
meal forever.
And your palate's
Yes.
going to change too.
Your palate definitely.
Your
does
palate
change.
changes. So you'll start, as you start to incorporate more nutritious whole foods, you'll notice your palate will change. You won't even want to go for fast food, whatever you're
It's the
thinking
same thing
of.
with fitness.
Yeah.
Yeah.
Like you can't tell everybody to run a marathon.
No.
You have to find something that you like so that they'll do it.
Yes. You have to enjoy movement. You have to
Because-
enjoy food.
Yeah, because if I don't know you as a patient or as a person and what you enjoy doing, then I can't prescribe, you know, a fitness program to you. I can't prescribe the nutrition plan.
Right. They have to enjoy it. I mean,
Yeah.
especially if they're going to implement it into their daily lifestyle.
Yeah.
It has to be something that they're going to enjoy.
Right.
So it's a habit. It's like getting up, brushing your teeth. Oh, I'm going to go eat this, or oh, I'm going to go do this for movement.
Yeah.
You have to enjoy what you're doing. You have to enjoy what you're eating.
Yeah. So I'll ask, like, who does the grocery shopping? Who does the
Right.
cooking? Who are you cooking for?
Mm-hmm.
Are you cooking for young kids? Is it just you and your husband? Are you cooking for only yourself? Are you cooking for extended family? You know, how do you feel about leftovers and meal prep? And I mean, I know some people who will not eat leftovers, so they don't want to
Yeah.
make.
I know people like
they
that.
don't want
think
a meal
that's
prep.
crazy because I love leftovers.
I
I
love
love
leftovers
I love
too.
leftovers too, but I know a lot of people that don't like leftovers.
The
I
only
know.
thing I won't eat leftover is sushi or fish.
Oh no!
Oh, yeah,
You know
that's
what's
not the
great though?
best.
My neighbor doesn't like leftovers, so whenever he cooks too much, he always brings it over to me.
Stop.
Oh.
Yes, he's like, I have an extra plate of food for you.
Oh, that's the
guys."
best neighbor. That's the best neighbor.
Yeah.
Oh.
So yeah, it's just you have to know the whole aspect of the person in order to provide them with the best plan
Yeah.
and
Yep.
something that is sustainable
And
Yeah.
and enjoyable.
that's what's wrong with basically everything.
Mhm.
People just aren't connecting.
No, we're not. We're not. So to switch gears a little bit, I
Okay.
guess we could just touch on it, and this will be another podcast. Well,
I'm scared.
but let's talk about sex a little bit.
Oh. Okay.
Oh gosh, if you guys could see all the looks. So I'll start it off. So, I mean, obviously, women enjoy sex. I enjoy sex. Sex is a big part of a person's life, whether you're connecting with yourself or you're connecting with your partner. I think it's like a really important part of health and wellness, and I talk to patients about that all the time. It's really interesting because my older patients, couples in their 80s, they are so easy to talk about sex, their
Really?
relationship. Yeah, and I've learned
so
from
interesting.
my couples that are in their 80s that the best sex is in the morning because they wake up, they're fresh, they're energized, they don't have to go to work, they're just there together, and sex in the morning is the best.
Yeah.
Right.
Which, I mean, we all enjoy sex in the morning,
Yeah, I
but
think that's true.
so, but I found that interesting. I was like, wow,
I
that
would
is a
feel
great.
like that generation would be a little bit more prudent about it.
No,
Well,
oh
they're
my
just gotten
gosh,
older where they don't care.
they're
anymore.
not.
They're allowed to say whatever they want.
They're so open
Yeah,
about
let's
it.
talk about
Yeah.
the villages, okay?
Yeah, that's a good point. They're super open about it, and and I just love that they're enjoying their life no matter what their age is, and they're
Right.
very open about it. And if there's a problem, they want to nip it in the bud and get right back on that horse and enjoy. Like
Mhm.
they're ready to go. So sex is a big part of health and wellness. So for me, sexuality is really important, and I love to be sexy and feel sexy and get to know my body. So I think it's important, and this is, I think, I mean, we talk about it with our girlfriends. It's a little different because we're talking about it in a microphone, and there's a lot, who knows who's going to be listening, but getting to know yourself and understanding your body, you have to be able to enjoy yourself in order to help your partner enjoy yourself.
So
So
you have to know what you like.
You have to know what you like, and you have to feel safe when you're with a partner.
Safety is so huge.
Yeah.
And be able to like trust that person that you can tell them what you like.
Right.
Yeah.
Yeah. So that is really important. So if anyone's listening and you're questioning those things, like getting to know yourself, or you're having trouble connecting with yourself on a sexual level, that's normal, but like go for it and like learn your body. It's okay. I've had a couple patients over the years that were uncomfortable learning their own body and touching their own body and experimenting with their own body. And I think we don't talk about it enough, but it's okay.
Well, I think there's like a sense of shame, and this is really going to be like out there that, you know, comes from maybe like religion.
Yeah. Or how they were brought up with their parents.
And it's like shameful to connect with yourself or with anybody else, even like just anything around sex, like shame. We don't do that. We don't talk about that. And so I think maybe especially like when we were kids, I think it might be a little bit less now, depending on if you're involved in, you know, a heavy religion, then maybe yes. But I think that has brought a lot of shame into that conversation.
Yes. And I think too, though, we have to think about social media now. I'm not on social media nearly as much and understand all the inner workings of social media nearly as much as a younger person, but I know they have a lot of exposure to a lot of things that we didn't when we were younger. And so that's kind of scary because that's going to affect their sexuality too, I think.
What about the different, like as far as talking about sex for wellness, what about the difference in having sex with somebody that you have like a deep connection with versus like a one night stand type of thing? Can you talk about that?
Yes. So from a medical perspective, so oxytocin plays a role. And so for women, sex, the connection, the mental connection for a woman is so critical. Now, I say that from a personal experience and from what I, learn reading articles and talking about it. Not to say that a woman can't go out and have a one night stand and just feel great and have the best orgasm ever. I'm not saying that. But typically for women, there typically has to be some type of emotional component to it. And hey, you can go out and meet someone quickly and connect and go and have a great time.
Right.
But for most women, the way our body works mentally and how we think about things in that connection with oxytocin and estradiol and testosterone and progesterone and how all of our neurotransmitters work and everything that's going on in our body, typically the best orgasms, the best feeling, the best satisfaction sexually is when you have that real connection with that person. And it takes time to build that. Men are a little bit different, but still men like emotional connection.
Men are a lot different.
They are. I was being polite. Men are a lot more visual than women too. So, and having said that, some women are very visual too, so and again, it's a personal preference to a point. There's genetics that play in there, and then hormones, of course. But I think for the most part, as humans, we like connection. We like to build a connection with someone, even if the connection is 2 or 3 hours that we're meeting someone and we really feel connected with them and we're super attracted and we want to go have a good time.
Right.
So, but some kind of connection. I think that's just human nature. And it's okay to do that. You have to be safe, of course, and think about, I'm always, talking to patients about being safe because you don't want to catch something. You don't want to, because sexually transmitted diseases are a real thing, and oftentimes some of them that you get, they last a lifetime.
And they affect all ages.
They do.
Ask the villages.
That's right. What did they say? The herpes is the gift that keeps on giving.
Oh, jeez.
I've also heard that it's the confetti of the
like you can never get rid of it.
STD world or whatever.
Oh,
Yeah,
gosh.
it just spreads.
I know.
everywhere.
Yeah, you definitely don't want. But back to sex for women and getting to know your body and enjoying yourself, I think is really important. And I do. It's an important part of overall health and wellness. It's not good not to be sexually active, whether it's just you and yourself and your body, or you with your partner. So it's an important part. That release that you get, the oxytocin is such a very powerful antioxidant. It's so important and good for our health and wellness. And then for men too, there's all types of implications for their prostate.
Right.
So to maintain prostate health,
Do not give them any more excuses.
Right, like how much is too much?
But this is for my prostate breathing.
Prostate health. Oh my gosh, I guess, should we rewind and take that part out, girls? I know. Oh my gosh, that's funny. But so what are some other topics? We could get even juicier with sex. But...
No, but I think back to, like the sex.
Okay.
Just like going out and the one nights for women. Like I feel like yes, you can do that, but can you handle what happens after that?
Yes.
Because I feel like, it seems like these days like there's a lot of women that do that, and I think the more that you do it, like when I talk to, the younger generation, it seems like it's more accepted and common for that to be going on. And I feel like you just begin to be numb to it, and then it becomes like not really special for you, or
it's harder to connect with somebody.
It's harder to connect when it's time to connect.
When it's just a physical act that you're going through.
Yeah, so I think women need to be careful because, maybe physically you can handle that, but can you handle that emotionally and mentally later after it has happened so many times? And obviously men can handle it because they've been doing it forever, but most of them, because they're just built different.
They're wired completely different.
So I wanted to say that because I feel like I don't want anyone to hear that, oh yeah, just go out and like do that and it's totally fine, because maybe it's fine if you feel like you can handle that, but there's always a price to pay for the choices that you make.
Sure.
Absolutely.
So mentally and emotionally, it might not be okay.
Right. And that's a very good point. And it's so important to remember that, because you're right. There's all types of repercussions to any actions, and especially that. And for women out there who value their body to a point that they don't want to do something like that. Again, sex is a very personal choice that you have to make, who you're going to have sex with, whether it's yourself, your partners, or when you want to do it. I think that's a very individual choice, and you should feel I guess I want to say proud, or just feel good about your decisions that you're making. You don't have to shame Yes, you shouldn't feel shameful about the decisions you make around that. And if you don't want to have sex and you're saving yourself for that special person and developing that relationship, that is absolutely beautiful. And if you're the person that is, hey, when I meet someone and I'm feeling it and that's good for me, that's okay too. But like Lauren was saying, you have to be okay with that, and you have to be ready to accept the consequences of the actions that you choose. And sometimes
they're not always just physical.
They're not always just physical, correct. And so you have to be emotionally ready for that if you choose to have sex with anybody. whether it's a long-term relationship or just some short-term enjoyment, actually,
Yeah.
So that's a really good point. And I think for women, we put a lot of pressure on ourselves too. There's a lot of social pressure on us about that. I'm woman, hear me roar. I can do what a man does, and things like that.
I can, but I don't want to.
Right.
That's a good point. I like that.
Yeah.
I can, but
I don't want to.
Yeah.
Choice, having that choice and feeling confident and proud to make the choices that you make. And that's, whatever those choices are. I mean, we live in America. We can make those choices, which is really exciting.
Yeah.
That we have the freedom to make those choices.
Sometimes I have to do the things that men do, but I don't want to do them. I just want you to highlight that part.
I know.
Can we just title the whole podcast that?
I know.
I can do that, but I don't want to do that.
I mean, I'll tell you, like, I'm pretty old school. Like, in my perfect world, men go out and people might not like that I say this, but in my perfect world, men go out and make the money and bring home the bacon, and women take care of the family. I'm very nurturing and I'm very mothering, and that's just who I have always been. And I love what I do now. My children are grown. I have grandchildren. It's just me and my husband, but I loved being a mom. I loved being a wife. I loved being at home. I loved cooking every day. I liked taking care of my house and my kids, and having time with my girlfriends, talking about dinners and recipes, and doing all the stuff that you do as a housemaker. Like, I just loved it. I mean, that was just me. And if I did it all over again, I would do it the same way. My career is important, but at that time, being a mom and being a wife, that was my career, and that's really important. And it's everybody's different. So, some women that's not important to them, and that's okay. And that's the beauty of having.
I'm the opposite.
See, and
I tried to be a stay-at-home mom, and I lasted 3 months. So.
See, and that's the beauty. And what's so wonderful is that we have those choices. We can make those choices.
Yeah.
And have that option. So I think that's nice. And some women, again, don't have that option too. So we always have to think about that. Yeah. Some women don't. Some women may want to stay home and not have the option. Some women have to stay home and want to go out and have a career, and they don't have the option. So, but yeah, my perfect world, I loved being a mom and a housewife. So, I don't know. Everybody's different strokes for different folks.
Well, I think that personality is really common amongst nurses too.
Yes.
Like, nurses are such caregivers, and the nurses that I know outside of work are just like so loving and nurturing. They'll do anything for anybody. A lot of times they get, people will call them like a pushover, but that's just the way they are built.
Yeah.
And just like men and women, people are all built differently.
Yes.
And they all have strengths that make the world go round. And if we didn't have people like that,
caregivers, right?
Yeah, then we would be missing a major part.
Part. Yeah, that's so true. I'm
just not a caregiver.
Yes, you are,
Breezy.
I'm not really. I also say I could never have been a teacher.
Really? Oh.
No way. I don't mind educating adults.
Oh, but
I always say, like, a person that can go into a classroom and love like 20 other kids as much as they love their own kids is like an angel.
It takes a lot.
Because some of my kids' teachers are like, I don't know. I think sometimes that they love them more than I do.
Do they have children? Their teachers?
Yeah, a lot of them. But like my son's kindergarten teacher, oh my God, she was the best.
Oh gosh, kindergarten teachers are
best.
Elementary school teachers are just, oh my goodness, I don't know how they do it.
I mean, she would, and then their first grade teacher, she was amazing too. And the fact that she was really hard on them, like strict. Like, I was afraid of her. Like, if she called me into the room to like have a conversation, it's like, oh my God, I felt like I was getting called in the principal's office. But she was just amazing with the kids. And then like once you got to know her, she wasn't scary. She was just strict and like had a schedule for them, which I think as far as like a 6 to 7-year-old needs, it was great. It kind of trained them up to be structured people.
Right.
But Yeah, I could never have been a teacher either.
Teachers are so underpaid.
Mm-hmm.
Good teachers. And we entrust them with our babies.
Mm-hmm. I mean, they have your kids for longer than you do sometimes.
They do. They absolutely do. I think teachers are so underpaid. We always need good teachers. That's another whole podcast for teachers. Shout out to teachers. Go teachers. Yeah, I love teaching. I think like so much of what I do with my patients, I'm constantly teaching, students teaching.
Mm-hmm.
Like I really believe knowledge is power. And
I love teaching too.
Yeah.
I feel like I could be an elementary school teacher.
Oh yeah.
I could see that in you, Lauren.
I don't think I'd want to be a middle school teacher.
Oh no, middle school's hard.
That's so tough.
I could do high school and I could do elementary school.
Middle school is tough.
Mm-hmm.
It is. I would always say middle school is like the time that's like transitional for your kids. Like middle school is where kids really transition and you start to see what path they're going down. It's so hard, and kids can be so cruel at that time. Their hormones are raging, they're crazy, they don't know what's going on, they can't figure it out inside what's going on inside their own body and their brain, and it's a hard time on kids. Middle school is tough. Yeah, I wouldn't want to be back in middle school. It's just a hard time. Do you guys remember that for your kids? I remember it was just a hard time.
I remember, yes, for my kids and also myself.
Yeah.
My kids were in middle school during COVID, so it was tough.
Oh, that's so hard.
Because they had to be in their classroom all day. You know, they couldn't go outside and play. They couldn't go to lunch. They had to be so many feet apart.
Yeah.
So it's hard for middle school kids not to be social and be together, you know. But going back to teachers, is there a teacher that you had as an adult, like through college or through your programming, that you really felt helped shape you?
Yes. So the physician that I talk about that gave me the terminology medical detective, he was just brilliant and just so ahead of his time. And he was really, the colleagues didn't really accept a lot of what he would say. A lot of times they would label him as a quack and stuff, because he really stepped outside the box, really took the time to find out what was going on with his patients, and would spend so much time with his patients educating them, and just really cared about each and every patient and go over and above. I remember him telling me, like, he would get up at 4:00 in the morning and he would be studying, and he would be getting ready for his day in the office, and he would just spend so much time with every patient, and he understood so intimately just what was happening at a genetic level, at a cellular level, and he was just brilliant. Just brilliant. And he loved what he did, and he took so much time, and I loved working with him and learning from him. And after I graduated with my nurse practitioner, he hired me to be in his office to go over all of the results that he would get after he would talk with the patients, and he would have me go over everything with the patients, because he would speak so fast, and he would speak kind of in clinical language that they would have trouble understanding. So then I would go over everything with him, with the patients, and I just loved working with him. He had such an impact. And I have to give a shout out to my ex-husband. He had a huge impact on me too. He's an amazing physician. And again, we both had a time in our lives where we dove into functional medicine and just really took a lot of time to learn all of that. We both kind of learned together. We worked together in the office. We learned together. And he was just, he's brilliant too. Just wonderful. He's still a great clinician. He still practices. My mentor had passed, but my ex-husband's still practicing and caring for patients all the time. So they both had a huge impact on me. So yeah. What about you guys? Any specific mentors or teachers?
Yeah. So if I go back to when I was graduating from college, there was definitely this teacher that I asked her for a recommendation for a program that I wanted to get into for my master's. Oh. And she actually told me, she's like, I don't think you're cut out for a master's.
Are you kidding?
Yes.
Wow.
No, I'm not kidding. And she drove me in a way, like the opposite way. So it was one of those like, well, I'm going to show you. And so that kind of drove me to kind of to look outside of Florida as far as my programming and what were some other places that I could apply to. I actually like specialize in research. I had to write a thesis that got published. So like she was kind of like a driving factor in the back of my head. Like, I'm going to show you, like, I can do this and I can do it really, really well. And then I would say, as far as how I was saying, like, I learned a lot more in practice than I did like in the classroom. There was a number of doctors that I would say, 20 years ago, like dietitians weren't really looked at as like a part of the interdisciplinary team.
Right.
And there were a handful of doctors, when I moved back here, that really would take the time to talk to me and explain things to me and help me to understand things better as like a whole patient perspective and not just like nutritionally, and actually listen to like my feedback and what I felt the patient needed, and we like implemented things. So I would definitely say that there were, an ICU doctor, a nephrologist, and a pulmonologist that I can think off the top of my head that really, when I hear their name now, I'm like, oh, I love them. You know?
That's so good.
Yeah.
Yeah, and ICU doctors and nephrologists and pulmonologists, I mean, they are in the thick of critical care.
Yeah.
So they really are, I think, the type of provider that has such a good understanding of what's happening at the cellular level and really understanding the biology that goes on inside the body.
Right.
And they practice that way.
Yeah. And like being here in Ocala, we're not at a teaching hospital. For them to take the time to teach others, it really meant a lot.
Yeah, that's great.
Yeah.
And that's so nice. We have people locally.
Yeah.
Where we are that have such an impact, and caring for patients, so important, because critical care is a big deal. That's where medicine really shines. I feel like our medicine, Western medicine, really shines when we're dealing with critical patients, critical care patients.
Right.
That's where our strong suit is. The prevention part, that's where I think we need to work on. And I think we're getting there. We're moving in that direction. It just takes more providers to catch on and be more interested in it, I think. But I think we'll get there eventually.
Well, and I think, too, having the team aspect to it. Mm-hmm. Like not having the mentality that only a physician can help make a person be their best.
Right.
No. So how you've incorporated me and Lauren and like the whole approach to a person's wellness.
Absolutely. In mind, body, spirit. And that's why when I added the mindset to it, I felt like that was a piece that we were missing. Mm-hmm. So now I'm so excited to have Tammy help moderate and teach and have that 8-week course, Refire Yourself. So really connect with yourself and understand that mind body piece, because that's really, true vitality is mind body. Yeah. So you have to have a healthy mind and a healthy body. Mm-hmm. You can't have one without the other. It's the same with movement and nutrition. You can't be eating great but not moving and expect to be optimally well, and you can't be moving and then eating crappy and expect to be optimally well. Mm-hmm. It's the same with the brain. There's that huge component with our mental health as well. Mm-hmm. So important. Yeah, and then of course cellular health is foundational, and that's where it all starts. So that's what we really focus on, starting there at the foundation, and then we all build and care for the patient. Genetics, another big one, which I think that really is the way of the future. That's precision medicine. What is a person's genetic predisposition? Okay. What's their cellular health? Okay. How is their environment influencing everything? Okay. What should they be eating? How should they be moving? What hormones do they need? What do we need to be doing for this person? And I that's precision medicine, and that's what every woman and every man deserves. Mm-hmm. And I think we'll get there. But that's what we do at My Venus Club, and that's exciting.
It is exciting.
Well, guys, we've had a great conversation today. I can't tell you guys how much I appreciate you really being raw and opening up. Thank you so much, both of you, for being here. The episode was not about having perfect answers, but it was really about being real. And I think women need more of that. I really do. Because so many of us walk around thinking we're the only ones that may be struggling or questioning ourselves or feeling lost or carrying pain. And pushing through, just saying, we just need to push through. But every woman really has a story, and every woman has lived through something that's really shaped her life. And sometimes the things that felt hard and messy and unfair, those things are really what shapes us. So, if you're listening today, I really hope you heard something that made you feel seen. And I hope you give yourself permission to honor your own story, because your story really matters. And the woman you are becoming is worth showing up for. It really is. So thanks for joining Lauren and Bree and myself today for this raw and real conversation. Keep listening to your body. Keep building your foundations. Keep giving yourself grace. And keep becoming the woman you've always dreamed to be. Thanks, girls.
Thanks, Cindy.
Thank you for being here with me today. If this episode resonated with you, I invite you to share it with someone who may need to hear it also. And if you're ready to start understanding your body on a deeper level and getting the clarity you deserve, you can learn more about my Venus Club at myvenusclub.com. We offer a limited number of memberships for women who are ready to take a more personalized, in-depth approach to their health. So apply for a membership. There's no pressure, just an opportunity to start a different kind of conversation, one that focuses on you, your body, and what you truly need. Because once you understand your body, everything changes. I'll see you in the next episode.